Good afternoon, Jenny. Thank you for joining us.
Good afternoon, Dan.
Now, you've just come away from your presentation really focused around the GS1 standard. And you've actually, whilst you are currently at Mölnlycke Health Care, you've been working around GS1 standards in many industries for many, many years.
Yes.
What I'd like to ask is, you were saying that retail, you actually can't work with a product in retail if you don't have applied the GS1 standards.
No.
How is it that retail have managed to figure this out, but medical device industry seems so far behind?
Okay, well in retail you've got the big boys like Tesco, Carrefour, Walmart and Asda who actually got together in a collaborative state to ensure that the supply chain was made more efficient, and they actually dictated to the manufacturers, if you don't put the barcodes on the products, then we won't sell your products. So it was determined by that route, whereas in healthcare there is nobody taking that stance, so it's had to go to the regulators to start developing something.
I suppose this comes out from what one of the other speakers was saying, the fact that really all hospitals are individual identities and don't really have that collaborative power that, say, the large retailers do.
No, the nearest you've got is somewhere like the NHS in the UK, and they had too many internal issues and they're too far disjointed to be able to get together and determine that sort of standard for themselves, really. It was something that was needed to be done externally.
And you, of course, in your work at Mölnlycke have been undergoing a huge project to bring in GS1 standards.
Yes.
Perhaps if you could tell us a little bit more about it.
Okay, it started off about 2.5 years ago. We got the backing of the board and we started looking at what we're actually putting on our products already. We were aware there was legislation coming out, so we took the legislation into account. We didn't just go ahead and say we're going to adopt this standard. We looked at the legislation, we looked at what was out there. We then determined that we were going to use GS1 standards, and we thought, okay, do we actually meet the standards with what we're applying to the products currently? And obviously we did in certain aspects, but there was a lot of aspects where we didn't meet the standards.
That was one area that was actually quite surprising. You were explaining how you did a test and what came out of that.
Yes, we actually took a selection of products from our warehouse and we actually verified the quality of the barcodes that we were applying, and we looked at whether we were using the correct symbols as well as the print quality, whether we met the standards regarding the size requirements for all these products. And the results were not actually very good. So we've spent the last 2.5 years determining what we should be doing, working with the factories on an individual basis to put right what they were doing wrong, changing artwork designs where necessary, and then re-verifying the products and implementing the changes within the factories.
So where are we up to now?
We are in the final implementation phase. We're just in the process of monitoring the factories sort of on a product level to see which ones have been done and which ones haven't, and we're aiming by the end of December to be 90% compliant with GS1 standards. The 10% where we're not compliant are company acquisitions, where we're still working with these new companies and there's still investment required and still more design changes needed. So that 10% will be hopefully within 6 months of next year compliant.
So what were some of the biggest challenges to making this project a success?
I think because we're a global company, sort of the spread of all of our factories, so it meant actually visiting different parts of the globe over a long period of time. Getting the backing of the board to begin with started off being quite a mammoth task, but once they understood the principles they were happy to back the project, and to be fair, without their backing this would never have happened.
So what are some of the things? Obviously it's a design question in a lot of cases. It's to do with, you were talking earlier in the presentation about it being to do with the magnification, the size of the piece, but what other impacts does it have, say, on what data is stored?
The big thing at the moment is that the regulators have not defined exactly what is going to be required for each packaging level within the barcodes. We've really taken a bit of a flyer on this aspect, and we've said, okay, we're going to go with everything. We're going to put as much information into these barcodes as we can, because then we're going to meet the standard. So we know we're going to include lot numbers, expiry dates, serial numbers where applicable into the barcodes.
And just out of interest, which systems are you now using then for barcodes? Because I know that one of the things we saw was how operating rooms actually have to have multiple scanners for different types of barcodes.
Okay, we're using GS1 standards. We do have some linear barcodes, but we are moving towards the 2D data matrix barcodes. The only difference there is if the hospital has an old scanner that was purchased probably 4 or 5 years ago, then it will be an infrared scanner that can only read a linear barcode. The newer scanners that are camera-based can read the 2D and the linear barcodes, so if the hospital has a newer scanner, providing they've set their software up correctly, they will be able to read both linear and 2D barcodes.
Oh, thank you very much for taking the time to speak with us. It's been genuinely fascinating. If people want to find out more, where can they go?
They can go to the Mölnlycke website, which is www.mölnlycke.com.
Thank you very much.
Okay, thank you.